Here in the neurology ward we have Lady Aurora, who's currently in a coma. Unfortunately, she has no advanced care planning and has yet to appoint an enduring power of attorney. Poor Aurora has been in this state for a while as her auntie Maleficent is wanting the life support to be turned off, but her three aunts want to continue fighting. To help Aurora, the guardianship tribunal convened, and Philip Princely was appointed legal guardian. He ultimately decided to give her a comfortable death. Little Cinderella was recently admitted for malnourishment after she was put under the care of her evil stepmother. During her stay, she required some TPN. On this morning, the nurse on the ward round was due to give her next dose. However, Cinderella had gone and changed rooms. The nurse then had to go to all the rooms, checking the identity of each patient, until she finally found Cinderella after diligently confirming the correct name, date of birth, and URN. Mr. Dumpty is a crabby old man who is old and frail and awaiting nursing home placement. Today, while attempting to go to the bathroom, he fell out of bed and onto the floor. He subsequently broke his hip and he'll have to be put back together again, or at least they hope he will. And here we have Alice, a young woman who was admitted after experiencing an acute psychotic event. She was subsequently sedated and was coping well on her new antipsychotic medication. This morning, however, the med chart had been written incorrectly, and Alice was given the wrong medication and ended up going back down the rabbit hole. Over in the infectious disease ward is Goldilocks, who was admitted after being bitten by a bear. After a good washout of the wound, she was started on antibiotics. But this first antibiotic gave her hives, and the next antibiotic was far too broad. The third antibiotic, however, was given after sensitivity results came back, and it was just right. And then there's Dr. Pinocchio. He's an ambitious young doctor who wants to climb the rank in the hospital to become a real consultant. Along the way, he gets requested to do a procedure and assures the good doctor it will get done. He lies to the doctor about his level of skill and attempts to do the procedure all by himself. Unfortunately, he ends up botching the procedure and injures the innocent patient. Because of this, he is requested to appear before the Board of Professionalism. He is reprimanded and a restriction imposed onto his clinical practice. And finally, there's the sad, sad story of Sister Rumpelstiltskin, who one fine day was cleaning away a trolley after it had been used for cannulation by a junior doctor, when suddenly she felt a prick on her finger and looked down to see an exposed and inappropriately disposed needle. After she had administered first aid, she immediately contacted the occupational medicine unit to report the injury. She now nervously awaits her test results. Poor Sister Rumpelstiltskin.